Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the medical assessment unit today. Are you Mr. Adam Smith, 63-year-old?
Yes, doctor.
Well, I understand from the GB letter that you have a change in your voice. We are here today to discuss your symptom and what we can do further. And I'm going if you allow to examine you. Is that okay with you?
Okay, doctor.
Okay, at first, can you tell me by your own word what brought you here?
Doctor, about it started about 3 weeks ago. I got some cold, and after that, I noticed that I cannot talk like before. Something in my voice is getting somewhat different. That I cannot produce much sound, and the volume is very low. I thought that it was due to some cold exposure. I avoid it cold after that. Then took a cup of coffee a day, but this didn't help me, and rather I think it is progressing day by day, and I cannot produce much louder word now, so I don't have any pain, but I don't know why this is happening to me. Is it something from cold or is it serious? I don't know.
I'm sorry about what you are suffering, Mr. Smith, but can you explain more? What do you mean by change in your voice?
Doctor, I cannot produce much louder volume of voice. I think the voice is somewhat low in intensity, low in volume.
So you mean it is in form of lower the volume,
Yes,
but
doctor.
you don't have like hoarseness of your voice?
I noticed that some my voice is somewhat hoarse, not fine like before.
And do you speak clear, but it's in low volume, but your speak still clear for
Not so
other
clear,
can
not
understand
so
you,
clear. Somewhat coarse. It's not fine like before.
but other can understand you or no?
Yes, they can understand.
Okay, and you said it is 3 weeks before. Before this 3 week, do you have any problem in your voice?
No,
And from 3 weeks until now, how it is progress? Is it the same or progressing?
progressing.
Uh, and uh, anything make it better?
No, doctor. I tried a lot of folk remedies like taking tea, keeping my neck warm, but that didn't help me.
Anything make it worse?
No, I haven't found anything.
Do you have any other symptom along with the change in your voice, like cough, for example?
Yes, doctor. I had cough for a few years. That is mostly dry cough. I didn't produce much phlegm.
And it is from 3 years ago.
Yes,
And does it change last 3 weeks?
yes, doctor. I noticed that I cannot produce sound in cough.
And do you have any phlegm with the cough?
A little.
Can you describe the color and amount?
It's white.
And the amount?
Very little, doctor.
Any blood on it?
I noticed blood 3 times. It is red.
3 times.
Yes.
And in the previous, do you have any similar history?
No.
What is the amount of blood, please?
Very little, doctor.
Is it clear or dirty?
Red.
And does it mix with the phlegm or surrounded?
Mixed with phlegm.
I'm sorry about that. So, Mr. Adam, uh, do you have any difficulty in breathing?
No.
Do you have any problem in your nose?
No.
Any problem in your ear?
No.
Did you have any injury or trauma to your nose and throat?
No, doctor.
Do you have any chest tightness?
No.
Any chest pain?
No.
Any noisy breath?
No.
Any ear problem?
No.
Fine. Mr. Adam, along with this symptom, do you have any high body temperature?
No, doctor.
Any sweating?
No.
Any change in weight?
Yes, doctor. I also noticed that I am losing weight, and for last 3 months, I noticed that I've lost about 4 kg weight.
And how is your appetite?
I think it is somewhat less than before.
Is it the decrease in weight? Is it intentional or
No,
unintentional?
doctor. I have no intention to lose weight.
And do you notice any lump or bump in your body?
No.
Any skin rash anywhere?
No.
Any skin rash when you exposed to sun?
No.
And anybody notice that you look pale than
No.
before? Any yellowish discoloration of your skin?
No.
Fine, Mr. Adam. Can I ask you if you have uh, any tummy ache,
No, doctor.
any acid feeling in your stomach,
No.
any food particle or regurgitation in your
No.
behind of your chest,
No.
any sore throat?
No.
No sore throat.
No.
And do you have any bowel change,
No.
any hard stool or loose stool,
No.
any blood in your back passage?
No.
Did you suffer any headache before?
No, doctor.
Any fits?
No.
Any weakness in any part of the body?
No.
Any numbness or pain?
No.
Uh, okay, Mr. Adam. And do you have any change in your eye?
I told you, doctor, that I lost around 4 kg weight over the last 3 months.
Eye, in your eye,
No.
eye redness or
No.
so, Mr. Adam, can I know if you have any past medical history of note?
No, doctor. I had asthma in my childhood, but I am not having any problem for last 50 years.
And do you take any medication?
No.
Any over-the-counter medication?
No.
Do you have any allergy to any medication or anything?
No.
And any previous operation,
No.
admission to hospital,
No.
uh, a blood transfusion,
No.
any similar history in your family?
No.
Any history of cancer in your family?
No.
Any history of cardiac issue or sudden death?
No.
Mr. Adam, can I know what do you do for living?
I was a constructor, doctor, but now I do nothing. Actually, I'm enjoying my leisure life.
And are you supported financially?
I think I am.
Good to hear that. Can I know if you smoke?
Yes, doctor.
How many cigarettes and for how long?
It is quite a lot, about 15 to 20 sticks a day. That is for around 40 years.
Mr. Adam, the smoking is very hazardous to your condition and your health in general. I advise you strongly to stop smoking. If you agree, I will refer you to smoking cessation clinic. Is that okay with you?
Okay,
And do you drink alcohol?
occasionally. 10 minutes have passed.
Uh, and you know the social limit?
Yes, doctor. I usually don't take more than 15 units a week.
Okay, so that and the, have you ever exposed to anyone have the condition called tuberculosis?
No,
Any any do you have any previous occupation or job?
yes, doctor. I was constructor.
And do you expose to asbestos, for example? You know the asbestos?
Not asbestos. I usually worked with concrete, bricks,
Hmm.
and cements.
Okay. And any exposure to radiation exposure?
No.
Okay. Can I examine you, Mr. Adam?
Okay.
Okay, I will have a general look to Mr. Adam. How is if there is any cachexia, any bailer, any
This is a
jaundice?
surrogate, but you can examine. He's not catechic.
Okay, I will look to I will ask him to speak to hear his voice, and I hear already during the examination. I will look to the finger if there is any finger clubbing,
Yes.
nic nicotine staining,
Yes.
palmar erythema.
No.
I will look to the pulse if it is regular,
Yes.
blood pressure,
130 over 90.
respiratory rate.
14 breaths per minute.
I will check for lymph node in the neck and under the arm.
No palpable lymph nodes.
I will look to for pallor or jaundice in the eye.
No.
I will look to the mouth for any abnormality.
No.
I will ask him to protrude his tongue and see the uvula if there is anything there.
No.
I I will examine the chest if any reduced sound, any dullness,
Yes. Reduced sound is present.
where
Left lower zone.
left lower zone. Okay, any additional sound in the
No.
respiratory system? Okay, I will look to the thyroid if there is any thyroid enlargement.
No.
I look to abdomen for any organomegaly.
No.
Lower limb if there is any pedal edema.
No.
Okay. Mr. Adam, what is your concern for me today?
Why I'm having this, doctor? Is it a serious condition?
Mr. Adam, after I talk to you and examine you, there is many possibility in my head. Uh, I need to admit you and study your condition thoroughly and do for you many investigation. There is many differential. I'm sorry to tell you that, but the top of my differential, I need to rule out a malignancy in your chest and in your throat.
What do you mean by that, doctor?
Mr. Adam, because you have too many risks and your symptom raise suspicion of abnormal growth, tissue growth in your windpipe. Sometimes there will be abnormal growth in the windpipe affecting your voice and your breathing as well.
That means you suspect that I have cancer.
Yes, I'm sorry to tell you that it is one of my possibility, and I need to rule it out. For that, I will refer you for a group of specialists, including lung physician and my consultant and radiologist, and I will do for you basic investigation and imaging for your chest and abdomen, and you need camera test for your throat and windpipe, and maybe we need to take tissue for study and analysis, and I will meet you again to inform you the result. Is that okay for you?
Okay, doctor.
For now, you need to stop smoking and and any more concern for me today, Mr.
No, doctor.
Adam?
No, thank you.
Thank you.
So have you reached your diagnosis?
Most likely diagnosis, maybe there is polyp in the vocal cord, maybe it is malignant growth, and maybe there is carcinoma of the lung with extending to the vocal cord and causing pleural effusion as well.
Okay. Anything else do you suspect?
Hmm.
Respiratory tract infection, candidiasis, or
Could be,
infection of the cord.
yes.
Okay. How will you investigate him?
Patient need, aside from basic investigation, complete blood count, renal function, liver function, electrolyte, inflammatory marker, coagulation profile, chest X-ray. He need to vocalize the vocal cord, and he need CT for chest and abdomen and pelvis, and respiratory pulmonary function test. And he will, if there is suspicion of tuberculosis, we do acid fast BCG for and sputum culture.
Yeah.
And if we need the drain for the pleural effusion, we'll do LDH, glucose, and cytology, and protein, and acid fast BCG.
Do you think
And
that
serum.
bronchoscopy should be done?
Yes,
Okay.
bronchoscopy and
And why do you want to perform CT scan of abdomen and pelvis?
for staging.
Okay.
And for possibility of biopsy, maybe you need biopsy under in endoscopy or under CT guidance.
Okay. So how will you manage him? Suppose it is a case of carcinoma
Management
lung
with
with
multiple
palsy.
MDT, including my consultant, the pulmonologist, the chest surgeon, oncologist, physiotherapist, and nutritionist. and the specialized nurse. We will, after investigation, confirming the diagnosis by biopsy, doing staging, if confirmed diagnosis of carcinoma, and refer for surgery or chemotherapy and radiotherapy according to the stage,
Okay, fine. Thank you.
as well as stop smoking.
Okay. So your approach was very fine. That was good. You have excluded that what he meant by saying his voice. That was fine. But I think you should have also excluded a few other things like voice overuse, the commonest cause. Okay. If he talked too much with loud, any party, and second commonest cause is the upper respiratory tract infection. Did he have any cold or soreness in the throat before the onset of this symptom? Okay.
But is it enough that he mentioned by himself that symptoms started after respiratory tract infection?
Yeah, you should have excluded that if he had any cold or fever or any sore throat before that, and also said that this is painless. Was it painless all the time or uh, initially painful? Okay, and does he tried voice resting or anything else that would make him worse or better? He could maintain that. Okay, and in the systemic query, I think you should have asked something like any focal neurological signs, any problem with swallowing.
Yes.
Okay. Also, can be other causes like cardiac causes. Microrestus, you have excluded that any shortness of breath, chest pain, leg edema. Then causes like laryngeal nodule, laryngeal carcinoma, then laryngeal nerve palsy secondary to what is called secondary to carcinoma of the lung, then superior vena cava obstruction syndrome. Did he notice any changes in facial appearance? Okay. Then other thing is that any hypothyroidism that also present with changes in the voice. So you should have asked about any weather preferences, any hot or
Yeah.
cold preferences. Okay.
Yes.
Otherwise, everything was fine. And you mentioned to the patient that I am suspecting a malignancy. Malignancy is a medical term. Okay, always you should mention like cancer. Okay, fine. This was good. One thing that did he take any medicine for his cough? They should have asked with emphasis that if he have taken anything for cough, like suppose this can be a presentation of is candidiasis, upper pharyngeal or
Yes.
laryngeal candidiasis that can present with chronic
Yes.
nebulization
Yes.
inhaler. Okay, so you should have asked specifically that do you use any medication for you? Did you use any medication for your cough?
Yes. This should be differential.
Yeah, and another differential that patient also had exposure to silica. Okay,
Silicosis.
can be a silica.
Well,
That patient has cough.
in what occupation this silica? Where it is?
Patient was a builder,
Come.
and he was exposed
Silica.
to
Where we can find silica?
it's cements used for building, concrete. They also that is sand. Sand contains silica.
Mm-mm.
Okay, so that can be there might be some association that the patient also have cough that would be for another reason, or that can be from initial presentation of cancer.
Yes.
Okay, fine. You did well.
Thank you.
Okay, then I am taking some food. In the meantime, if you have any case for me, then you can send it. I
Okay.
will join. Okay, I take
Okay.
some
Thank you.
food. After that, I will let you know.
Okay. Thank you.